Hello, it's Ryan Liberty, and in this video I'm going to answer the question, what is persistent depressive disorder, also known as dysthymia? Ooh, Alright, hello, and let's get to what persistent depressive disorder, also known as dysthymia, is. But first, there's just one thing that I need to say, which is that this is not the diagnostic criteria for persistent depressive disorder, also known as dysthymia. This is just a description of it. It's not meant to be used to diagnose anybody. In any way, you should be going to see a therapist or a licensed professional who would be able to give you a diagnosis if that's what you're seeking, so don't use this information for that purpose. And also, if the label of persistent depressive disorder or the label of dysthymia bothers you in any way, if it doesn't help you to heal, if it feels like a burden in some way, you don't have to use the label. It's okay. Really, this is just a description to get you pointed towards something that may be going on in your life. So if it bothers you, just drop the label. That's totally okay. So with that said, let's get into what persistent depressive disorder, also known as dysthymia, is. And I have a lot of notes because this is a wide topic here, so you'll see me looking down quite often. But let's get into what it is. So it's something that happens when you have a depressed mood for most of the day, for more days than not. And it's at least 2 years, and it's something that you can be reporting as happening, or somebody else could be saying that's something that they observe in you. If it's a child or an adolescent that's going through this, it could be for, instead of 2 years, just for 1 year, and it may, instead of being a depressed mood, may show up as irritability. So while depressed, there has to be 2 or more of these things going on. Overeating or low appetite, hypersomnia or insomnia, fatigue or low energy, low self-esteem, difficulty making decisions or poor concentration, or a feeling of hopelessness or feelings of hopelessness. And so during this period, that there cannot be more than 2 months that it's been without these symptoms. And the criteria for major depressive disorder has to be present and ongoing for 2 years. I do have a video on what major depressive disorder is, so that is worth checking into. And I'm also going to be mentioning major depressive episodes as well in this video, so you may want to go over and check out that other video when you're done, just to get the description of what those are. So major depressive disorder has to be present and ongoing for 2 years to be, for this to be going on, for persistent depressive disorder to be going on. There's never been a manic or a hypomanic episode or cyclothymic disorder. Sorry, all these words are tripping me up today. None of that can be going on for persistent depressive disorder to be happening. This is not something that's better explained by persistent schizoaffective disorder, schizophrenia, delusional disorder, or other specified or unspecified schizophrenia spectrum, and other psychotic disorders. So none of those can be happening if otherwise it's not persistent depressive disorder or dysthymia. It can't be something that's due to a substance or a medical condition, and it's something that significantly impairs your everyday life. So there's a number of specifiers that we use to clarify exactly what's happening when somebody has persistent depressive disorder. And the first thing is that they could be a mild, a moderate, or a severe disorder. So it really comes down to the number of symptoms that are going on. Mild would be less symptoms, severe would be a lot of the symptoms. You also have something that's called impartial remission. So in partial remission, so that's a period of less than 2 months where there's no symptoms, or there's a period where not the full criteria are met. And in full remission is when in the past 2 months no symptoms were present. With anxious distress is one specifier, and to have with anxious distress, you have to have at least 2 of these. So tense feelings, restless feelings, trouble concentrating because of worry, fear that something awful is going to happen, or a feeling that you might lose control of yourself. If you have with anxious distress as a specifier, it indicates that there could be a longer duration of symptoms, higher suicide risk, or greater likelihood of treatment, not responding to treatment. There's also a specifier of with mixed features, and you have to have at least 3 of these. So expansive, elevated mood, grandiosity or inflated self-esteem, pressure to keep talking or more talkative than usual, racing thoughts and flight of ideas, increase in goal-directed activity and energy, increased involvement in activities that have high potential for painful consequences, for example, overspending, poor investments, or sexual promiscuity, and decreased need for sleep, so feeling well rested even though you had less sleep than you normally would have. So you got to have at least 3 of any of those, and it has to be something that's observable by others, and it's a change from your usual behavior. If the symptoms are met, if they meet the criteria for mania, then a bipolar diagnosis would be appropriate. And all of this can't be happening due to a substance. So if you have with mixed features, it indicates a significant risk for the development of bipolar 1 or 2 disorder. There's also with melancholic features, and to have this, this specifier, there has to be one of these 2 during the most severe period of the depression. So either a loss of pleasure in almost or all activities, or no reaction to things that are usually pleasurable. So you've got to have one of those, and you have to have at least 3 of these. So profound despair, moroseness, or despondency caused by depressed mood. Depression is worse in the morning. Waking at least 2 hours before usual awakening, excessive activity or slowed activity, significant weight loss or anorexia, or inappropriate or excessive guilt. And when you have melancholic features, it's more likely to occur during a severe depression or in a depression with psychotic features. There's also a specifier of with atypical features, and this does not mean that it's like rare or unusual or anything, it's just the label that they give for it. And what it means is that there's a mood reactivity, so your mood brightens up a little bit sometimes. And you have to have 2 or more of these for that to be going on. So significant increase in appetite or weight, hypersomnia, leaden paralysis, which is when your limbs feel heavy, your arms and your legs feel kind of heavy, or a long pattern of rejection sensitivity that limits your functioning, and that's a trait. So with atypical features cannot be with melancholic features, and it cannot be with catatonia. There's another specifier with psychotic features, and that's when there are delusions or hallucinations present, and when there's mood congruent psychotic features is when the content of the delusions or the hallucinations are consistent with depressive themes like nihilism, disease, death, personal inadequacy, guilt, and deserved punishment. And there's also with mood incongruent psychotic features, and that's when the content of the delusions or hallucinations do not involve those themes, or they involve a mixture of those themes and not having those themes. There's also the specifier of with peripartum onset, which is when symptoms occur during pregnancy or the 4 weeks following delivery of the baby. 3 to 6% of women are going to experience this, of pregnant women, and 50% of instances begin prior to delivery. This can feature psychotic episodes, which may lead to infanticide, so it's worth noting this as a specifier. And for the following of these specifiers, I got 4 more specifiers to get through. If these 4 have the most recent 2 years are what we're looking at when we talk about these specifiers. So you have with pure dysthymic syndrome, and that's when the full criteria for major depressive disorder have not been met for the past 2 years. Then you also have with persistent major depressive episode, and that's when the full criteria for a major depressive episode has been met throughout the past 2 years. There's also with intermittent major depressive episodes with current episode, which is during the past 2 years, full criteria for a major depressive episode have been met, but there have been periods of at least 8 weeks with symptoms below the threshold for a major depressive episode. And there's also with intermittent major depressive episodes without current episode, and that's when during the past 2 years, full criteria for a major depressive episode have not been met, but there has been 1 or more major depressive episode. And again, if you need clarification on what a major depressive episode is, I do have that in the video for major depressive disorder, so check that out. All of this said, there is treatment for persistent depressive disorder, also known as dysthymia, and that is something like cognitive behavioral therapy, psychodynamic therapy, interpersonal therapy, medication. Really, the best thing to do is to go see somebody who can put together a personalized treatment plan for you, therapist, a qualified professional, And of course, you know, this disorder is very depressed. There's risk for suicide, there's risk of suicidal thoughts. So there are hotlines that you can call, there are text lines, online chats, depending on your country, what region you're in. I urge you, if you're feeling any of those things, to please go check out those resources. It is there for that purpose. Don't feel ashamed or embarrassed or like it. Just do it. It's okay to use those resources. That's what they're there for. So what does it feel like for the person who has persistent depressive disorder? In the body, I'm just going to give you a brief overview. It's really all of the things that major depressive disorder have. In the body, you've got insomnia, hypersomnia, fatigue, excessive energy, change in weight or appetite, anxiety symptoms, aches and pains. For your thoughts, there's one major change from major depressive disorder, which is there's a thought of, I've always been like this, because persistent depressive disorder is a longer term thing. We tend to believe like, this is just the way I've always been, this is just how I am. But you'll also have trouble thinking and concentrating, trouble making decisions, difficulty recalling things, thoughts of death, suicidal ideation, inappropriate self-blame. Emotionally, you're going to feel intense sadness, anhedonia, alexithymia, melancholy, irritability in children, or anger, guilt, low self-esteem and self-worth and hopelessness. And behaviorally, the things that you do, you may have outbursts, you may withdraw socially, you may neglect pleasurable activities, have less interest in and desire in sex, have trouble sitting still, you may pick at things, have slowed speech and reactions, poor performance in school or at work, and you may prepare or attempt for suicide. And if you are feeling those feelings, again, I just want to urge you to reach out to a hotline. So that is persistent depressive disorder, also known as dysthymia. I hope I've given you a well-rounded look at it. I hope I've given you a good, complete view of what's going on. I would love to hear your story with it if you or someone that you love has been going through it, because we need these human experiences. We need representations of what's actually going on. So please leave it below if you have something to say about this, and I appreciate you taking the time to learn about it with me today. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below, because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.